let's first start with, what is CIA, or otherwise known as Collagen Induction Acupuncture?
Well, we did, a videotape earlier, so hopefully it's coming up with this conversation. You can actually see the procedure being done. It comes from the science of acupuncture. If you take an acupuncture needle and insert it into the skin, the fibroblast cells in the dermis, these are the cells that actually create the collagen matrix. They will be stimulated by the penetration of the acupuncture needle, and they will release a cascade of growth factors. Now, growth factors are the initiating step in the physiological process of creating new tissue. So anywhere in the body that you are creating new tissue, whether it's new tissue in your kidneys or your liver or your knee joint or muscles or skin, that process starts with the release of growth factors, and those growth factors are the kind of like the messaging molecules that attract to the location all the necessary physiological resources needed for the body to generate the new tissue in that area. So fibroblast cells release a cascade of growth factors when you insert a acupuncture needle into the dermis. So you could take a single acupuncture needle, the kind that we use for Oriental medicine, which we do here actually, but that's not the purpose of this conversation, those 3-inch needles. And you could simply make a whole lot of little punctures like this in order to stimulate the creation of new dermal collagen, through the release of growth factors. Well, that's kind of an arduous way of going about it. So instead, we have little tiny surgical acupuncture needles, and instead of 3 inches long, they're only about 2 millimeters long, and they fit onto a surgical device like you saw in the video. And those needles are vibrating because the device has a little reciprocating electrical engine in there. And those needles are vibrating very, very quickly. And as you move the pen, looks like a pen, across the skin, you're making hundreds of little tiny acupuncture insertions at the rate and at the depth necessary to stimulate or to reach the mid-level of the dermis.
So there's not any risk with an acupuncturist taking an individual needle going too far, because these needles are designed specifically for the right amount of depth to hit the dermis.
Exactly. And the dermis is different thicknesses in different areas of the body, and the device can be set so you're hitting exactly the right depth you need.
So you can probably go a lot faster also, because you're having a lot of needles going at the exact depth it needs to be and covering the whole face.
Right. The reciprocation of that device causes an insertion of the needles about 80 times per second.
Wow.
So in a half-hour procedure, you're going to put thousands and thousands of little acupuncture insertions throughout the face, the skin of the face.
And so how many passes do you need to make across the face to have a full maximum result of a acupuncture?
Really only one pass.
Really?
Yeah, because again, the needles are vibrating so quickly. So just one pass, all the way up, and all the way down, you'll cover the whole area.
Wonderful.
Takes about 20 to 30 minutes.
Wonderful.